Welcome, ladies and gentlemen, to the Men's Sexual Mastery Podcast. Today we're going to dive into the back door. We're going to talk about the male G-spot, the prostate. This seldom explored, but very, I don't even know
Mysterious.
what to call it. It's very mysterious. It's still mysterious to me. I will say I have not explored
Me too, man.
long or deep enough to really know what's possible there. But Ben, I know that you have explored a little bit more than me, at least, and found some immense benefits to starting to open up the prostate through internal stimulation. And it's something that comes up. It's interesting in the work that we do. We work with many different types of men, and some men are really very interested and curious about this, very receptive to it. Some men have a lot more resistance, but through and through, everyone that we've worked with that has gone into some degree of exploration with the prostate has shared that it was very valuable and beneficial.
Mm-hmm.
And whether there was immense pleasure experienced or just the ability to soften and relax and surrender a little and to open up and to meet a part of ourselves that has been considered taboo or dirty or just kind of not a place where there's any value in exploring for many people. So I'd love to hear from you, Ben. What comes up for you on this topic of the prostate? And I know you like to refer to it sometimes as the male G-spot.
Mm-hmm.
Yeah, just tell us a little bit about your experiences there.
Yeah. This is often like a very taboo. This is like the further reaches of edginess for a lot of men to get into, because there can be a lot of homophobia associated with it. For those who aren't aware, the prostate is a small, like walnut-sized gland that's part of the male reproductive system, and it's part of what creates the fluid that our semen travels into. And when you have an ejaculation, there's a convulsion of your prostate. So whether or not you're directly stimulating your prostate, which is done via the rectum, that's why there's all these, taboo subjects around it, know that you're experiencing on some level the pleasure from this gland already every time you have an ejaculation. So we often say that there's many roads up the mountain in exploring non-ejaculatory orgasmic states, and this is the back door. This is one of the optional routes. And this is an optional part of our training. In the bonus materials, we do have a mini course that I've created on getting started with the prostate. So today, the intention with this time is just to give guys a little bit of a foundational understanding of what this is all about and how to get started. So for a lot of guys, as you mentioned, Hawks, it can be the quickest route to like opening up these psychedelic like states. And for many men, it can be extremely uncomfortable. We've seen the entire range, the entire spectrum. But one of the key reframes or contexts that I like to give to guys in understanding what this is I like to refer to it as like a form of myofascial release of MFR that's going to the root of the pelvic floor, which we've spoken about in many other podcasts. And this is a huge part of the training. The tension that we're holding in the myofascial tension we're holding in the pelvic floor can often be one of the main contributors to performance problems for guys. When you have a tight pelvic floor, when you're a tight ass, we say, it can carry all sorts of detrimental effects to your ability to have strong erections, and to access some of these other states. So when you're bringing in this practice of applying pressure to your prostate, and that can be and the reason we call this the male G-spot is it's literally the same position you would find the G-spot on a woman if you were laying on your back. It's up and in the anterior, I think they call it, pelvic floor towards your stomach.
Mm-hmm.
It's like up in the rectum and then scooping forward. So all of this to say, as you apply pressure And you start to rub that area, given the right circumstances, it can activate pathways of pleasure that can take you to a whole nother level of sexual experience. So framing it, I think, as like a form of myofascial, like trigger point release, going to the root of the pelvic floor, releasing tension so that it allows you to have higher levels of not just sexual performance and increased blood flow and all these things, but also huge levels of pleasure. And so, yeah, that's the key reframe I like to give guys who are just getting
Mm.
started.
Yeah, that's really great. I appreciate that breakdown and that myofascial release, this capacity that we have to actually target the pelvic floor opening and softening through that back door, through the rectum, actually, is something that pelvic floor therapists do actively work with for men. Like if you're a man and you go to see a pelvic floor therapist, there's external work that can be done, and there's internal work that is often done as well, and that is accessed through the rectum. And so there's that aspect of it that is absolutely beneficial from a musculoskeletal and blood flow circulation
Mm-hmm.
perspective, as you spoke to. And then what a little gift, or a big profound gift, that actually there's also so much pleasure to be experienced there. And I feel like, just sharing from my own personal perspective, the relatively modest amount of internal exploration and work that I've done, I have not personally found consistent pleasure in that area.
Mm-hmm.
I've I've accessed little glimmers of it, but more numbness, I would say. And I
Mm-hmm.
think that this is also an interesting thing to work with, and this shows up in females as well. Like in the yoni, there is
Mm-hmm.
often areas of numbness where there is the potential for pleasure, but first and foremost there's numbness, and then sometimes after the numbness dissolves through continued conscious and compassionate work, then that numbness may actually transition into pain or discomfort, and working then through those blockages, it can transition eventually back into pleasure. And I'm curious about the relationship for us as men with the rectum, and there being oftentimes a lot of numbness.
Mm-hmm.
And
Mm-hmm.
curious what comes up for you, Ben, around why that might be. And yeah, if you have anything to share from your own experience or
Yeah.
around that. Yeah.
Yeah, that's a great. I love that you brought that up. The correlation to it's. I would say it's one and the same. Like a de-armoring process is what we typically call that.
Hmm.
There's a process of just feeling what's coming up, and if like myofascial release and a lot of this stuff, that's exactly it. You got to feel what's there, and initially there might be a lot of tension or even pain or numbness or resistance, whatever it is. You keep feeling through it. You keep breathing through it and releasing those holding patterns in the body. And then beneath that can come new sensations, and the pleasure is through that process. So yeah, you nailed it on the head. And, the answer or the question why that's there, I think is that's like that's a whole, PhD in itself, probably. Like my personal theory is, we're all carrying different forms of tension in our bodies. We're holding things in the fascia that can be related to traumas in this lifetime, or some people say previous lifetimes. Like if you believe in the concept of the soul, or consciousness moving through different lifetimes. Also, you could just say genetic ancestral tension. Male to male violence and rape. Um, can lead to a lot of these holding patterns being passed down from one generation to another. And on a larger scale, if you just think about like what it is to be a tight ass, it's like to be so caught up in our minds, so young, so externally focused, that we're completely disconnected from our bodies. And like that tension that so many of us as men carry, like bringing our attention to that tension and releasing that it's super psychosomatic. It's like there's so much tied to it in how we're showing up in day-to-day life. And so I just mentioned that as, not just patterns that we're bringing into it, the holding patterns, but also some of the transformation that can be experienced. It's not just pleasure or sexual performance or something like that. There's like a very deep level of surrender and being able to completely get out of your head, which is the requirement for anything to move forward in this space, which I think is like the most important work we could actually be doing in this realm as men, is getting to the root of that tight ass programming that we've been all carrying around. And also I wanted to mention, we hadn't mentioned it yet, but like, I'm glad you brought in the pelvic floor work, and how it can be internal, just as much as external with an actual pelvic floor therapist, just to destigmatize this. Also related to that is prostate health, and prostate cancer and different diseases guys can get. Right now, statistically, 1 out of every 2 men will have some form of prostate issues in their life. And I want to get into it a little bit, but the tool that we recommend and we tell guys to get started with, it's called the Aneros, and it's this trigger point device that is inserted up the rectum and sits against the prostate and has these tabs that sit on the perineum and basically act as a massage device for your prostate, that originally was designed by a prostate doctor or prostate researcher who's a doctor, as a substitute for going into getting a rectal massage or a prostate massage from a doctor, which men, in their 40s and 50s and 60s are, really encouraged to do to help promote prostate health. So one other side benefit of this is also, you could say you are helping minimize your symptoms or your likelihood of having prostate issues, because you're bringing stimulation and blood flow and you're releasing the tension and the holding patterns in this area. So
Mm.
yeah, there's a lot of reasons why this is something to check out. And of course, I get it. Like, so many men may feel triggered even just hearing this, or like so resistant, but I promise you, if you're willing to go into it and the root of all the tension that you're carrying, that there's something for us there. So yeah,
Mhm.
that's all. That's what kind of comes up for me around it.
Yeah. Yeah. Shout out to the Aneros. It's
Mm.
Japanese engineering, I believe, right? So
Yeah,
it's
yeah, yeah.
developed
And
in
we'll
Japan.
drop a link in our podcast notes here, an affiliate link, and
Mhm.
highly recommend it.
Yeah, and to clarify with that Aneros, it's not a vibrating,
Mhm.
mechanized tool. It's totally analog, and
Yeah.
it's relatively small, maybe just a little bigger than a finger or about the
Mhm.
size of a finger. I think they have different models, but it's yeah, it's just a really well designed tool for specifically targeting the prostate. And like you were saying, Ben, that the prostate issues are so prevalent for men, and it's really interesting to look at that pattern that you spoke to. I'm glad you brought it back around to the tight ass, because that you
Mhm.
shared that with me years ago, and it really landed as like, oh yeah, that is such a common thing. And what we are all familiar with that term, like, oh, don't be a tight ass. And if
Mhm.
we think about where does that come from? What does that literally refer to? Well, it's tension in the ass, in the glutes and in the rectum. And all of that tension creates constriction, which blocks blood flow and circulation. And if we
Mhm.
look at the meridians, from traditional Chinese medicine, and the microcosmic orbit, which
Mhm.
you may very well be familiar with if you've been tuning into our podcast or exploring this type of work for a while. This circuit of energy that moves up the backside of our body and down the front side of the body, and it starts at the perineum. It doesn't necessarily start at the perineum, but
Mhm.
it comes around the perineum and then over the tailbone, the ass and the rectum, and then up the backside of the spine. And if we look at
Mhm.
physiologically, we have our genitals, and then just behind the genitals is the perineum, and
Mhm.
just behind that is the anus. And that energy is flowing in a circulating
Yeah.
microcosmic orbit, that energy is flowing from our genitals, from our sexual center, past the
Yeah.
rectum. But if there's all of this constriction and tight assness, that's like a kink in the hose
Mhm.
of our blood flow and our energetic
Mhm.
circulation. And so it's just very clear to see for me that that tight ass pattern is going to greatly inhibit and block that flow of sexual energy from actually moving beyond just our genitals and nourishing the rest of our body. And
Yeah.
I can also see in this theory how that would lead to so much stuck sexual energy and sexual compulsion and impulses, because that energy isn't, it's getting blocked and it's not allowed to
Mhm.
actually flow through its natural cycles because of this pattern of tight assness. So that to me is just such a inspiring reason to continue to work with the pelvic floor externally and internally.
Yeah.
And and you said something else to me a while ago that also really stuck with me, which was, you can, someone who might have a lot of resistance to rectal work, a man who maybe there's programming of homophobia or just this like, ugh,
Mhm.
it's gross, I don't want to go there, I don't want anyone going there. Well, I think you said something along the lines of, you can work with it yourself now or have a loving partner support you
In the
in
comfort
working
of
with
your
that
own
area
home.
in the
Yeah.
comfort of your own home.
And access
Or
orgasmic states.
or you can wait 20 or 30 years and end up in a doctor's office with some with some relative stranger putting on a rubber glove and just sticking his or her
Yeah.
finger up there. And
Yeah.
like, which would you prefer? Personally, yeah,
Mm.
rather rather explore in the comfort of my home. Um, so yeah, there's a lot of
Yeah.
reasons there, a broad spectrum of reasons that we've touched on. And I know we're
Yeah.
coming up on our time here for today. So what else have we not mentioned, or what would you like to
Mm.
highlight as we come to closure with this discussion?
Yeah. Yeah. Well, you nailed all of the points that we brought up before within our community. And just so guys know, and again, just getting to the actual process, which is like so simple. It's literally, it can be very clean once you learn the process. And this is what's in our mini course on this within our community. There's a step-by-step protocol and system you can follow to ensure that it's not messy. It can be it is very sterile. Actually, you want to make sure it is. And it's very simple, and once you get your rectum cleaned, and once you insert it with a little bit of lubrication, you just let it sit in there basically. And you're just lying on the floor in like corpse pose, breathing deep into your lower dantian, as we call it, breathing deep into that area with a very focused, relaxed mind, releasing that tight ass, releasing the tight ass, releasing the tight ass. And as the aneros, this little tool, sits right, touching its tip, touching your prostate, as you release that pressure, it can start to, you can have little waves of spasms that come up, and that rocks these, they call it the P tab, but these tabs that are in your perineum. And that creates this ripple effect, this like action where as you go into any sort of spasm, it rocks and massages the prostate, the aneros forward, and that increases the sensation, which then can lead to more of these contractions. And it's kind of like this dynamo effect where the contractions are kind of feeding themselves. So that's like the basic framework for how that actually works. And again, that seems so simple. Just put it in there and relax and breathe. But there is so much deep work in actually getting out of our head and into our body and allowing ourselves to feel what's fully coming up, which is a lot of this, the deepest work we can be doing as men. So that's the last piece I guess I would add in, is that's a little snapshot of the process. And again, if you're interested in learning more about this specifically, there's plenty of stuff on YouTube, but then we also have a step-by-step, protocol and program within our training as well that you can follow. So, uh, yeah, welcome to check it out. And yeah, I know we're coming up on a training call in just 15 minutes or so we'll wrap this one up. But
Mm.
It's been great to drop in with you, Hawks, today. I love being able to talk about everything under the sun sexually with you, and for the brothers out there to like bring this stuff out of the shadow and into the light, that like it's not, has nothing to do with you being gay, by the way. We haven't said that directly, but like I'm very much a straight male, and like have found that this has only deepened my ability to show up with
Mm.
my female partner. So just, yeah, this is like, there's no shame about it. This is just myofascial, pelvic floor therapy. We could just call it that.
Mhm. Yeah. Yeah, thanks a lot for sharing, Ben. I appreciate your grounded take on this, and I love that one of those last pieces that you added in there, and how it has enhanced your capacity to show up with your partner. And I think that that's an important piece to highlight as well. Our capacity and ability to receive and to surrender and open directly correlates to how powerfully and compassionately we can give and penetrate. And
Hmm.
there's a lot for us to learn as men in that softening, surrendering, opening, and actually being penetrated, to understand more through more of a lived experience what it is for our partner to receive and open and be penetrated by us. And I think that that is also a really valuable place for us to approach exploring this type of work. So there's lots there, as you said. It's always nice to be able to explore everything under the sun and the places where the sun don't shine.
Bringing
So
the sun to where the sun don't shine. Let's go.
yeah, thanks, brother. It's good to drop in. Thanks to all the listeners. We'll catch you on the next one.
All right, brothers, be well.